trying to help people with depression, it's important not to look not just at serotonin, but to look at how we can help people use all those other chemicals in the sense of cause them to be released to help them feel good about life, so that would be their road to recovery. Another important aspect of neurotransmitters to let you know is that neurotransmitters cause us to feel these emotions, but the feelings also extend to our body. So now scientists are showing that neurotransmitters, when they're released, cause various chemicals to surge right throughout the body. And so the body can feel whatever's being released by the brain. All of that is to help you to realize that when you're depressed, it's not just something that's going on in your brain or in your mind. The whole body feels the effect of the depression. So never attack yourself or be angry with yourself because you can't quite get up to do these things. It's because actually you can't help it. That's what's going on in your body. To help people to come out of depression, we need to look at those deeper things and see how can we change the chemistry of your brain, which will then have a sort of resultant effect in your body. So now let's look at the whole aspect of antidepressants, medication that is available from any doctor. Depression or treating depression isn't just trying to change the imbalance of chemicals in the brain, because it's not just about the chemicals. That's just part of the story. And that's why even in this whole course of hope and depression, we don't just talk about medication. We talk about all the other things that we need to do to really help patients come out of depression. And you'll see why in a minute when I start to tell you about some of the research findings about medication and depression. Okay, so if we have a look at this next clip, it actually starts off by showing us the picture in depression. And we can see there that there isn't enough serotonin at the end of the neurons, so that when an electric impulse comes down one neuron and causes there to be a firing of the serotonin, there isn't enough serotonin released to cause this electric impulse to carry on down the next neuron. Therefore, there's an inhibition of brain activity because of the lack of serotonin. The word SSRI stands for Selective Serotonin Reuptake Inhibitor. The medication actually causes there to be a block in the first neuron that prevents the normal reuptake and recycling of the serotonin. Once the serotonin has been discharged, more of it is just wafting around, hanging around in that synapse so that the electrical currents can pass and brain activity can come back to normal. And this is the primary way that most antidepressants work. They work by blocking the reuptake of serotonin, so more of it is hanging around. There are some other groups of medications that work in another part of that neuron. So as I said to you earlier, we have this wonderful recycling mechanism in the neurons. But what normally happens is when serotonin is reabsorbed back into the neuron, over the process of time, the brain, this collection of serotonin molecules have been around a long time. Let's break them down and make some new ones. Well, another one of the antidepressants works by blocking that breaking down chemical. And more of the serotonin is just able to hang around and do the job that it's supposed to do. There are some of you who may be on lithium. Lithium is another antidepressant medication that works very well and has been shown to work best in bipolar disorders. And actually scientists don't exactly know how it works. They just know that it works and it's been around for many years, and that's why it's prescribed by a psychiatrist in a hospital setting, because extra care has to be taken with patients who prescribe that in terms of follow-up and watching for side effects and so on. One of the key findings that we've had maybe over the last 20 years or so is that we understand that the brain is wired in a certain way depending on habits that we have, thoughts that we think, sports that we play. The brain is wired to do things a certain way. But in the last maybe 10 or 15 years, we realized that actually there's something different about the brain that we didn't realize before, and that it can be rewired and it can regrow at any age. And this is absolutely fascinating because, you know, the expression, you can't teach an old dog new tricks, implying that as we get older, we're just stuck in our ways and we can't change our habits. what we're now realizing is that at any age, actually, the brain has got the potential to learn new things, to be rewired. And here's what a psychiatrist and brain disorder specialist in America said in one of his TED Talks. His name is Dr. Daniel Amen. And he said this: after 22 years and 83,000 brain scans, the single most important lesson my colleagues and I have learned is that you can change people's brains. And when you do, you literally change their life. You are not stuck with the brain you have. You can make it better, and we can prove it. And what he's describing and what science is now saying is the reason why we see that the brain can change is because the brain has got this ability, innate ability to change, which is called neuroplasticity. It is just an ability that the brain has. All our brains have it. And the word just means neuro, to do with the nerves. Plasticity means moldable, changeable. But in essence, it just means, as I said, new neurons can grow at any age. Old connections can be dismantled. So old ways of thinking can be changed, and new ways of thinking and behaving can be developed.